From stories across the world to stories here at home, this is the National News Broadcast. A very good evening to you. I'm Nitya Delivera.
A very good evening indeed. I'm Charita Minipurarachi, and let's move on to the headlines for tonight's news.
Facilities have been made for the people to receive first dose of the Sinopharm vaccine from any centre which provides the second dose of the same vaccine as from today. A further consignment of 727,000 doses of the AstraZeneca vaccine from Japan. The daily average detection of corona-infected persons in the US exceeds 100,000. People in Greece have been relocated to safer places with the intensification of forest fires. The United States wins gold medals in both men's and women's 400 into 4 meter relay events.
On to those and other stories in detail now, and starting off with local stories. The Government Information Department informs that general public not to leave homes unless attending to an essential task. The people should completely stop loitering in crowded places. It further says that people with inherent diseases should not go out unnecessarily unless attending to their employment. State Minister Specialist Physician Dr. Sudarshini Fernandopulle says that there is a possibility of receiving the first dose of the Sinopharm vaccine from any vaccination center that provides the second dose of the Sinopharm vaccine. She requests all people over the age of 30 years who have not yet received the vaccines to come to the center and get the vaccine. Inoculation of the second dose of the AstraZeneca vaccine has taken place in 63 centres covering the districts of Colombo, Gampaha, Kegol and Mathura today. The vaccination program at the Vihara Mahadevi Park in Colombo is taking place throughout 24 hours of the day today as well. Another vaccination campaign for people over the age of 30 years in the city of Colombo who have not yet received at least one dose of a vaccine has got underway at the Sugatadasa Indoor Stadium today. Police media spokesman Senior DIG Ajit Rohana says a program has commenced by community police communities to search people who have not yet received vaccines to direct such persons for vaccination. He added that nearly 5,000 persons have been directed for vaccination throughout the intervention of the community police committees by this afternoon. Meanwhile, the Government Information Department issuing a media release informed general public to receive the COVID vaccine without delay in order to save lives from the rapidly spreading COVID-19 Delta variant. The department further says that every person is facing the threat of being afflicted with the disease. The communique also says that around 1.5% of the infected persons die from the disease and a large number has to seek treatment at intensive care units. The Department of Government Information through the communique has provided several instructions to prevent affliction of the disease. Accordingly, it has informed first of all to receive the COVID vaccine without delay. According to the release, a majority of persons throughout the world have safeguarded their lives by receiving the vaccine. It also instructions general public not to go to residences unless to attend on extremely essential duties. It also calls all to completely refrain from attending weddings, funerals and other ceremonies where crowds gather. It is extremely essential to wear face masks when arriving in common places. The people who were also been advised to avoid using coverage locations such as restaurant halls, escalators and vehicles where assembly of peoples are a common occurrence. It is also compulsory to wash both hands with soap on several times of the day. Another extremely important health guideline is to maintain a space more than 2 meters between two individuals. The series of guidelines issued by the department further says that those who are having inherent diseases should not leave their homes unnecessarily and they should leave their residences only for essential purposes such as attending to their duties. Under the COVID-19 immunization program, so far 13,570,682 vaccines have been inoculated on the general public in the country. 38,665 persons have received the first dose of the AstraZeneca vaccine yesterday. The second dose of the same vaccine has been provided to 17,547 persons. The first dose of the Sinopharm vaccine has been delivered to 46,113 persons yesterday. The number of those who have received the second dose of the same vaccine has amounted to 2,545. Meanwhile, 3,830 persons have received the first dose of the Pfizer vaccine yesterday. The second dose of the same vaccine has been provided to 126 persons. 5,465 persons have also received the first dose of the Moderna vaccine yesterday. It has also been reported that altogether 1,762,905 million vaccine doses have administered on the general public in the past 7 days alone. The total number of vaccines provided yesterday at 114,291. The percentage of persons over the age of 30 years of the population in the country who have received at least one dose of any vaccine has increased to 94.56. The percentage in the Gampaha district was at 94.11 and the Kaluturu district at 87.54. The percentage in the Colombo district was at 83.59. The health division says more than 75% of doses have been inoculated on people in 18 districts. Meanwhile, another consignment of 4 million doses of the Sinopharm vaccine was brought to the island from Beijing City in China today. The Sri Lankan Airlines says that aircrafts of the Sri Lankan Airlines UL1869, UL865 and UL869 have brought the doses of the vaccine to the Bandaranaike International Airport in Katunayake. 727,380 doses of the AstraZeneca vaccine have also been brought to the island today as a grant of Japan under the COVAX facility. Our correspondent says that the Sri Lankan Airlines UL455 carrying the batch of vaccines has touched down at the Bandaranaike National Airport at Katunayake at 4:25 a.m. today. 1,825 persons infected with the COVID-19 disease were identified in Sri Lanka today. Meanwhile, 2,487 fully cured COVID-19 patients have left the hospitals today. The Ministry of Health has introduced telephone numbers for the general public to enable to resolve problems when admitting corona-infected patients to hospitals. These telephone numbers are 1999 or 11-011-796-6366. The relevant persons are able to obtain the necessary assistance by dialing these numbers. The police says 94 persons who have violated quarantine laws in the 24 hours past they ended at 6 a.m. today have also been taken into custody. Up to now, 53,453 persons have been arrested in connection with the same offence. Specialist Dr. Channa Pereira of the Lady Ridgeway Hospital in Colombo says that affliction of COVID-19 among children is on the increase. And meanwhile, the Director General of Health Services has confirmed yesterday of 98 COVID-related deaths occurred in the 5th of this month. 78 of the victims were either of the age of 60 or above.
Now, in the meantime, Director General of Health Services Dr. Asela Gunawardana has explained on this occasion on the latest data report on the doses of vaccines administered under the COVID-19 immunization program in Sri Lanka. He has also emphasized the importance of vaccination in order to prevent the affliction of the COVID-19 disease.
We have done a survey, house-to-house survey, with the help of police and all the Grama Seva Niladharis and all the officers at the Divisional Secretary's office. We have surveyed nearly 2,226 GS Division, Colombo, Gampaha and Kalutara, and we have came across that nearly 700,000 people yet to get 2 doses of vaccine, and because of that we are going to organize special clinic for these people in all these MOH areas and announce the dates to get the vaccine as soon as possible. Once we finish that activity, if the people are not turning out to get this vaccine, we'll have to go to their doorstep and vaccinate them. Vaccination is a voluntary, or the person has to give the consent. We can't vaccinate without consent, but a person who is not vaccinated is more liable to or more risky to get this infection rather than a person who is vaccinated. So if a person who is not vaccinated got the disease, will be spreading that disease to the other people in the community.
Specialist Dr. Hemantha Herath has clarified on measures that are being implemented to contain the spread of the coronavirus. In this connection, he has elaborated on the COVID-19 vaccination program.
At the moment, the immunization or vaccination program is continuing. Yesterday also, a new consignment of vaccines arrived in Sri Lanka, and all these vaccines, yesterday itself, all these vaccine stocks were distributed to the relevant districts where these vaccines are administered. And from today onward, in almost all districts where these vaccines were received, have begun the administration of vaccines to the public. And at present, most of the places we have, especially in the western province, we have almost completed the administration of the second dose of AstraZeneca vaccine, which was much awaited one, and there will be few more to continue in the coming days, and the Sinopharm vaccine is coming as expected in the batches that we have ordered, and we are confident that these vaccines can be given and almost all the target population could be covered within a very short period of time. Even at this moment, Sri Lanka has reached a level of vaccination on average above 70%, and first dose vaccine has been given to 70% of the target population, and in most districts it has gone beyond the 100% target, and that means they have gone more than the estimated population, target population in those areas. So in future there will be less congestion and less inconvenience to get this vaccine. Therefore, I would like to request all the public, anyone who has not got the vaccine up to now, please contact your nearest medical officer of health and arrange or get the required date and time to get the first dose of the vaccine what is available in your district, so that everyone will be immunized as quickly as or as early as possible to reduce the risk of transmission of this disease.
And tourists and art lovers will now need a green pass to show their vaccination, test or immunity status to enter some of the world's greatest museums in Vatican. The tiny city-state joins Italy in introducing the requirement.
The Vatican museums, which house some of the world's greatest art treasures, now require visitors to have the so-called Green Pass, proof of immunity with a digital or paper certificate. Tourists and art lovers waiting patiently to enter welcomed the measure. It was introduced by the Italian government on Friday to counter the highly contagious Delta variant. And the tiny Vatican state, which is surrounded by Rome, followed suit.
If
the Green Pass is how we get to enjoy our holidays and get back to normal life, so be it, says Rome resident Giussi Didio. French tourist Emily Girard also welcomed the initiative.
In France we already have it for several days, for nearly 1 month, and we work in a museum, so we are under the habit of doing so, and I think it is quite easier to put in place and to organize, so we are quite happy to use the Green Pass here also.
The Green Pass shows people have been vaccinated, tested negative or recovered from COVID-19, and it will be required to access closed places like bars and restaurants, gyms and cultural venues. France was the first European country to say it was making proof of immunity mandatory to access some services and venues, bringing in a health pass in July.
Moving back into the newsroom, home, a financial grant of 100,000 rupees each has been provided to 5 former LTT cadres today who were granted amnesty. The ceremony in this connection was presided over by the head of the Security Staff and Army Commander, General Shavendra Silva in Jaffna. The aim of the presentation was to enhance the living standards of the group.
The Deshapremi Eksajatika Paksha has handed over a complaint to the Department of Criminal Investigations today, requesting to halt teachers' protest and processions by taking into consideration of the COVID situation in the country. Convener of the party, Sudatheva Patrana, has filed the complaint. He added that if measures are not taken to ban teachers' agitations and processions, a fast unto death will be commenced in front of the Fort Railway Station in Colombo at 10 a.m. tomorrow.
Now, convener of the Teacher Principal National Collective, Venerable Ulapane Sumangalathera, says that the Teacher Principal protest march from Kandy to Colombo was terminated at the Pasiala town. The objective of the protest walk was to obtain a government solution to the problem of salary anomalies of teachers and principals. The protest march commenced for the fourth day from the Pasiala town today. Convener of the Teacher Principal National Collective, Venerable Ulapane Sumangalathera, said that his organization has decided to halt the march in consideration of the prevailing situation throughout the country. Convener of the National Collective, Venerable Ulapane Sumangalathera, has also accused the Janata Vimukti Peramuni yesterday for attempting to take political advantage of the teacher principal agitation. The Thera added that it was the JVP which has betrayed the struggle against salary discrepancies for a period of 24 years.
Tusker Nadungamuwe Raja has commenced journey with the objective of participating in the Asala Perahera Festival in Kandy. The Perahera Festival of the historic Sri Dalanda Maligava is scheduled to commence on the 13th of this month. A special feature has been that Nadungamuwe Raja will be participating in the Perahera this time after a lapse of 3 years. Raja is regarded as the biggest, the tallest and the most domesticated elephant in Asia. It has first participated in the Kandy Dalanda Perahera in the year 2005. Nadungamuwe Raja had been carried the sacred casket of Sri Dalanda Perahera since the year until the year 2018. The Tusker was not able to attend the Perahera festival for the past 3 years due to the Easter attack and the COVID pandemic. Raja, with the intention of reaching Kandy, has travelled in by roads and entered the Kandy-Colombo main road from Nelundeni area yesterday. The police special task force and the police provide security to Raja travelling on the Kandy road. Nadungamuwe Raja has reached his resting place in Tumukola Walauba in Ranwala, Kegol yesterday. It is scheduled to stay at this location tonight and resume journey tomorrow morning. The resting place of Raja's tomorrow will be the Hingula Raja Mahaviharasthane in Mavanella. The Mahout of Raja Kalumama says that the elephant has a good memory of its resting places. Raja stops at such places without any command. Nadungamuwe Tusker is scheduled to travel a distance of more than 100 kilometers to Kandy. The elephant is attending several other Peraharas of Viharasthanes in the island. There appears to be no listening in the love and affection extended by the people lining along the roads to the animal on its way to the Maligava. Owner of the Tusker elephant, Dr. Harsha Dharmavijay, always on alert regarding the health condition and the security of the animal. The 65-year-old Raja is expected to reach Kandy within 2 or 3 days. It will have a 2 or 3 rest day before attending to the task of carrying the sacred relics. Nadungamuwe Raja will be engaged in the noble task of carrying the sacred casket along with fellow elephants in the Raja and Kataragama Vasana.
Now, the health divisions say that the dengue epidemic is rapidly spreading in the country. It also warns of a serious threat on the health network of the country if the disease condition continues to expand. This fact has also been reiterated at a media briefing at the Department of Government Information yesterday. Dr. Nimakapan Nelahetty said that the reporting of dengue patients in Sri Lanka has increased since May of this year. In previous months, around 600 patients had been reported in a week. However, by now the number of dengue patient detections in a week has increased to 800. 17,134 dengue patients have been reported from all districts of the island. 3,292 patients have been reported in the month of July this year alone.
And meanwhile, plans are underway to cultivate 300,000 acres of land in the northern province using organic fertilizer. A farmer organization is to be provided financial aid amounting to 300,000 rupees in this connection. Measures have been taken to cultivate paddy in 250,000 acres of land and subsidiary crops in a further 50,000 acres of land in the coming season. Plans have been made for the manufacturing of 1 million metric tons of organic manure each year by every farmer organization in the northern province. A workshop on organic fertilizer production was held at the Makandru Development Research Centre in Gonavilla, Kurunagala recently. It was attended by 50 youth brigade representatives in the northwestern and western provinces as well as 20 organic fertilizer manufacturers in the southern province. The event was organized by the National Fertilizer Secretariat. A centre to sell harvest produce through the application of organic fertilizer in the Mahaveli zone of Moragahakanda, and a fair was declared open by State Minister Sripala Gramlath yesterday. The sales centre is located in Kahatapitiya in Moragahakanda. Presentation of checks to the farmers for their cultivation activities were also presented. Parliamentarian Amarakirti Athukurala was present at this occasion.
Chief incumbent of the Kotamudungala Rajamaha Vihare in Molagoda of the Shamapali Vanshika Mahanikaya of the Askiri Mahaviharya chapter, Rajakiya Pandita Mahopadhyaya Venerable Hingulwala Saranankara Thera has passed away today at the age of 100 years. The Venerable Thera has been a scholar of the Pali and Sanskrit languages and well versed in the Tripitaka Dharma. The final rites will take place at the Puja Pitiya crematorium at 5 p.m. on the 9th of this month. The remains now lie at the Molagoda Kotamudungala Raja Mahaviharya.
And with the Olympic update, we are going to conclude tonight's news. Do just tomorrow at the very same time. Stay safe.
Good night.